Hi, everybody. I'm Dana Donofree, and I'm the founder of AnaOno. I am also a 16-year breast cancer survivor. So, on behalf of the community, we thank you for your commitment and support. I'm excited to share with you information and training behind what could fitting a breast cancer patient or survivor look like. First off, I'd like to just kick off and say, we're not any different than what we were before breast cancer. So just remember that when you are encountering somebody who's either faced a new diagnosis or has been surviving for many years, we want to feel just as beautiful and comfortable and confident as we did before our breast cancer surgeries. Don't be afraid or scared of some of the terminology that we may use. You may not understand it, you may not be super familiar with it, but all of that is okay. Sometimes just listening is the best policy. Not having a lot of commentary is also okay. I think that something that's hard for all of us and something that we always train our staff here is that you don't have to apologize on any behalf of their cancer diagnosis or their surgeries that they're going through. What they're going through is really tough and it's really difficult. And being able to listen, but also being able to offer incredible solutions to help them get through their treatment is why they are there seeking your help and your attention. A lot of details about their life or their surgery or their experience. An empathetic nod and recognition of what they're saying is the most important. And you can just always encourage them to let them know that you guys are there for them and you are here to help support and guide them their new bodies, no matter what it is. At AnaOno, we like to say that we are chest inclusive. So we say two boobs, one boob, no boobs, or new boobs. We're here to support you. All surgery outcomes are very different when it comes to a cancer diagnosis. Patients can undergo a mastectomy surgery, which is the removal of the full breast that will leave a flat chest wall after the surgery. Some patients will opt to have one side, some patients will opt to have both sides. The other option is that they can have reconstruction after the mastectomy surgery. This would amount to either implant reconstruction, where a saline or silicone implant is input underneath the skin to mimic the old breast that used to be there, or a flap surgery. Flap surgeries are often associated through other fatty tissue parts of the body, whether it be the abdomen, the buttocks, or the inner thigh. That tissue is then removed from that area. It replaces the breast tissue, has a little bit more of a natural sort of touch and feel to it, but it's still not malleable natural breast tissue. The difference with the reconstructive surgery is that oftentimes underwires are not only incredibly difficult to fit, they may also be uncomfortable to that customer. So offering them underwire-free options that are in your collection is definitely the top choice. And of course, two of the AnaOno styles that you're carrying today are going to be great. But anything like a sports bra, a bralette, or an underwire-free style might be best. Something else that can happen with reconstruction is that they could be missing or void of a full apex. Reconstructive surgeries are a little bit rounder than they are pointier or droopier. So knowing that if you have a built-in apex, they may have a little bit of a bubble right where that breast used to be, but isn't there anymore. So be mindful of that as you are fitting cups or underwires if that's what that customer is looking for. The outcome of a mastectomy surgery is a flat chest wall. An option for many people with the mastectomy surgery is to wear what we call a breast prosthesis. This is an insert into a bra that looks and mimics the tissue of what used to be there, but helps them fill out any bra cups underneath their clothing. These are completely optional. Many women will wear them. They could let you know that they are wearing a breast prosthesis and that they desire a bra with a pocket. They may also just be wearing them up against their chest wall and or with a breast form cover. Many different shapes and sizes and proportions of these breast forms. So just know that you'll start really with their band size and their cup size, and the breast form piece will be a piece of that puzzle as we go through the fittings of the styles directly. Another surgery outcome is what we call lumpectomy or a partial mastectomy. That is when just a section of the breast is removed along with the tumor and what we call clear margins. So maybe a tumor is removed and it has been resealed through a scar that might be into the armpit, along the rib cage, into the breast fold, or potentially even on the top of the breast. These scars can be sensitive and can cause some additional pain and discomfort when wearing an underwire bra. So again, recommending options that are underwire free are really critical. And in addition to that, most patients that undergo a lumpectomy surgery or a partial mastectomy, which means a little bit of a fuller part of the breast is removed, but not the breast entirely, are often undergoing a additional treatment called radiation therapy. Now, radiation therapy can affect the skin in a sunburn-esque type of reaction. So what could happen during radiation therapy is that skin becomes very sensitive, can become very dry. A lot of ointments and creams are used during radiation therapy, and this process can last at the onset of radiation, halfway through, or even at the tail end, and can last for several weeks after the treatment has ended. There are some circumstances where radiation therapy can continue on beyond the treatment cycle to cause additional pain or discomfort, either with scarring or changes to the skin, but also shrinkage over time. So typically what can happen with a radiation therapy patient is their breast may become swollen during treatment, but then it could slowly begin to shrink. So some of your lumpectomy customers that come in might be a full C or a D on their natural side, but on their treated side, they might be a cup or 2 cup sizes different. This causes a bit of asymmetry when you're fitting the bra. And again, there are other options called partial breast forms that could be slid into a pocket or into the bra to create symmetry under clothing. But sometimes women just want to be who they are and they want to address the different sizes of the breast. So if you have a B cup on one side and a D cup on the other, you're going to really want to go back again to those underwire free bras to make sure that you're giving them the balance and the security to support both sides of their breast. That is all of my top fitting tips. I hope that that gives you some information on the words and some of the terminology you might hear from these customers. In the next video, we'll jump into the fitting of some of these styles.